This is Vince Lara in the College of Applied Health Sciences at the University of Illinois. Today I spend a few minutes with Chelsea Singleton, Assistant Professor in Kinesiology and Community Health, to talk about her research on the influence of food purchasing behavior on chronic disease risk in low-income and minority populations. Chelsea, I always ask, this is the first question I ask when I do these podcasts, is what did you always want to teach?
I was curious when I saw this question, like whether or not, how many people said yes?
Yeah.
Because my answer was definitely going to be no. So, no, I definitely did not ever think I was going to be a professor. When I was a kid, I thought I was going to be a doctor.
Okay.
So, mostly because, my family said you're going to be a doctor. They're like, you're smart. And I feel like whenever you have a smart kid, you're like, you're smart enough to be a doctor. That's like the job that you should, aspire,
Right.
But no, and then I got to undergrad and I was pre-med and I was doing well in it. It's just that it was not my interest. But I did have a strong interest in health and a very strong interest in health sciences. So I had to just kind of break out of that box, like, what else could you do in health? And I kind of stumbled upon public health, stumbled upon epidemiology. But I did notice that I always had the ability to deliver, I guess, like very quant heavy topics, easy to people. So I did a lot of tutoring in undergrad. Like I tutored chemistry, I tutored biochem, I tutored organic chemistry, and people were like, oh, you can deliver this material very well. So it kind of just made me passionate about teaching people about things. So now I teach epidemiology, I teach biostatistics, but no, never thought I would ever be a professor, but I'm very happy with the choice that I made.
Now, where did you do your undergrad?
Oh, well, you can't see me. People on the mic can't see me.
Right,
it's a podcast, but I'm wearing my Xavier sweatshirt.
Okay.
So I went to a small, historically black college in Louisiana, in New Orleans.
Okay.
They have a fantastic undergraduate pre-med program, pharmacy program, and now they're, building in programs like public health, biomedical sciences for their undergrads, and they actually put more African American students in med school. Like the students who do the pre-med program and pre-pharm program, they end up going to pharmacy school, going to med school. More than any university in the country. So they have very strong students come out. So I've been definitely trying to make connections between Illinois and Xavier, because we actually had a lot of students when I was there that are from Illinois. So it makes sense, like if they want to come back and be closer to family, they can do grad school here. So I've been talking to Vortec in the grad school about making those connections with Xavier. But yeah, that's where I did my undergrad.
Why did you pick Xavier? Are you from Louisiana originally, or
no?
Okay.
So funny story.
Yeah.
So I never knew the school existed. You're going to notice that a lot of things in my life is going to be me just stumbling upon things.
Interesting.
But I never knew the school existed until my senior year of high school.
Okay.
And I always wanted to go to Howard.
Okay.
So I was dead set on going to Howard.
Right.
I went to a college fair just randomly. Just got on the bus and went to this college fair. And they had all of the schools in alphabetical order, and Xavier was the last one. And the recruiter was just sitting there at the table. Nobody was around. So I just went and pulled up a chair next to the recruiter for Xavier and just started talking, because I was so tired because we were about to leave. And he started telling me about the program. He was like, we have a fantastic pre-med program. You said you want to be a doctor. We put more African American students in med schools than any university in the country. He waived my application fee. I applied. They gave me a scholarship, and so I ended up in New Orleans rather than DC at Howard. So, but yeah, and it was the best decision I ever made in my life.
Was it important to you to go to a historically black college? Like, was that something that your family? Okay.
So, yeah, it was definitely something that I wanted to do. My parents went to a historically black college. They went to South Carolina State, and they met there. And they just told me, all about their experience. Not just the partying and the fun, but also just like developing that camaraderie. Like I definitely see how going to Xavier benefited my career, because I now have a network of colleagues around the country who are researchers, doctors, pharmacists, and they're all African American. So whenever I meet young African American students, even students here at Illinois who are like, oh, I really want to work with you because you look like me. And that was also my experience. Like both my postdoc and my pre-doc mentor are African American women. So I see how important that is. I now have connections. I've been able to connect students with some of my best friends from undergrad who are, who are in medicine, who are in pharmacy, to mentor them as well. So it's definitely been very beneficial to my career. So.
Now, Illinois has a really diverse campus. And is that one of the reasons why you ended up here, you think, is the diversity? Did you like that it had that reputation?
Yeah, that was definitely like something I was very interested in. So when I applied for my job in KCH, the one thing I noticed was that the department was large and very diverse. Men and women of different types of background, different life experiences, some international. So that was very important to me because I definitely applied at other universities where there wasn't as diverse. So, it's kind of challenging coming in when you're a junior faculty and, you're going to be the only minority faculty in the department. So when I came in and I noticed that there was so much diversity, I said, okay. And then I noticed diversity among the students, which is also very important to me as well. That was definitely a selling point for KCH for me.
Now, I always ask this question as well. What inspired your research?
Okay, so I definitely have some stories, but I do research on the retail food environment, and I look at the food environment as a risk factor for chronic disease and poor diet. So I think what really got me into it first was when I was a kid, I grew up in a food desert. I grew up in Southwest Atlanta. And up until me getting ready to go to high school, we didn't even have like a nice full service supermarket within I want to say like a 4 or 5 mile radius around my neighborhood. And there was a small mom and pop type of store, but the store had really poor quality fresh fruits and vegetables, like their fresh produce, as well as meat, so on and so forth. And I remember one night, so I grew up in a single parent household. My dad raised me, my sister, my brother after my mother passed when I was really, really young. But my dad had to do a lot. So he was also a teacher. He taught high school in Atlanta for Atlanta Public Schools. But he would have to get off of work and then pick me and my sister and my brother up and then come home and cook. And he will always stop at this small mom and pop store. And I remember one night he stopped there. He got raw chicken because he was going to bake some chicken for us. And he brought the chicken home and he opened the chicken and was getting ready to prep it. And I came in the kitchen and the kitchen smelled terrible. And I was just like, what is this smell? And I walked over to the sink and I looked at the chicken and I felt the chicken, like I touched it, and it had that slimy film, which lets me know it was rancid. I was probably 12.
Wow.
And I told my dad, I said, Daddy, this chicken is bad, it's rancid. And he was like, are you sure? And my dad kept looking at it. He was like, now I have to get in the car and go all the way back and get my money back and then go somewhere else and find chicken. And the nearest supermarket was probably I want to say it was over 7 miles away from where we live. So definitely just thinking about how communities are designed and, how that plays, that's so important to our health. So, definitely, that was definitely one thing that inspired me. And then I was living in New Orleans at the time of Hurricane Katrina. I was a freshman in undergrad in New Orleans the year that Hurricane Katrina hit. So I'm in a member of Xavier's Katrina class. And just looking at how the food landscape of New Orleans was completely changed after Xavier. Some changed for the good, some changed for the better. Saw a lot of gentrification that happened. Companies come in, taking businesses and spaces from people where, a lot of it was, family owned or black owned or just owned by locals, and just coming in and just completely changing the food landscape. So that made me really interested in it as well.
That's interesting. You mentioned food retail and food purchasing and the effects that it has on diet and disease risk, and that's your focus. Talk a little bit about that, if you would. Like how food purchasing has such an effect on diet, especially in low income communities.
Yeah, so I look at a lot of retail. So I look at retail particularly, and there's so much to retail that affects our food purchasing and our diet that you might not even notice. And it's one thing. It's so funny because I was in Washington D.C. this week at a meeting where we're trying to develop a national research agenda for healthy food retail and marketing, and it has so much to do with what's going on with these large corporations, not just the supermarkets, but the companies that make these products. And us as scientists, we're trying to understand food purchasing. Like what influences in people's food purchasing that you're conscious of and not even conscious of, and then how that translates to your diet, and then ultimately your risk for various different chronic diseases. But there's so much about that goes into deciding what is put into your neighborhood in terms of grocery stores, and a lot of it is at the city level and even at the state level, sometimes even at the federal level, and then and then with the marketing component. We as, low-level scientists, we're scientists and we're trying to help people be healthy.
Sure.
But then we're looking at corporations who spend trillions of dollars a year on advertising. I mean, the Super Bowl is on Sunday, and you're probably going to see tons of ads about food.
Oh, yeah.
So how your neighborhood is designed, there's a lot more that goes into it besides just, popping a supermarket there. There were so many decisions that were made behind that, but yes. So looking at what you have access to, not only just driving distance, but also density of different types of stores, whether you have stores that sell healthy food or lots of stores that sell unhealthy food. We tend to call those food swamps. But a lot of that, if you're low income and you don't have access to a car and you just shop at the places in your neighborhood, that may result in you buying a lot of prepackaged goods, highly processed foods, and ultimately that's what you're preparing and serving to your family. And all these types of foods, they have a high fat content, salt content, cholesterol, just all of that stuff that leads to you having developing metabolic disease, you're developing obesity, high blood pressure, ultimately, diabetes, and then that might result in, loss of life or disability, you're not having like a great quality of life, so, long term, or premature mortality.
In the research you've done, how much do you find the food purchasing? And when you talk about food purchasing, you're talking about what the stores are buying from companies rather than what consumers are buying from the stores, or are you talking
it's
about
mostly what consumers are buying from the stores and what influences consumer purchasing behavior.
Interesting.
So I've done some work in Chicago, when we were looking at marketing, like what type of marketing people mostly see, and there's a lot to marketing. So, and it's crazy because we study it, the way we study is very different the way that the grocery store study it, because they put a lot of money into this. There are supermarket chains who develop like virtual grocery stores and have people come in and they literally study how people move around grocery stores to see what they're more likely to pick, and then they kind of segment the population based off your life, your profile, where you are in life. Do you have small kids? Do you have teenagers? Are you an empty nester? But then also, just even the stuff you see at checkout, what's available on the end caps, what's available in the middle of the aisle, what's available on the walls, around, and then all of these special floor displays, all of this is like prime space that these companies like Lay's and Coca-Cola, they pay for this space and they put a lot of money into their advertising. So we take a look at all of that and making decisions about what they're going to purchase. So, but yeah, there's a lot that goes into food purchasing.
How much of it comes down to pure economics, and how much of it comes down to maybe people aren't informed the way they should be about what they're eating anyway?
We're starting to see that a lot of it does have to do with your preferences, your education, your interests, or just, your family dynamic, or your culture, just what you're used to buying, and then also what you trust, like the brands you trust and what, just your life in general, because we have seen, there's research that has come out over the last 10 years that shows that if I live in a food desert and I just put a grocery store in a food desert, it really doesn't change much, So it fixed the social justice issue.
Yeah.
That, we have a community that doesn't have a supermarket. So yes, there's a social justice, food justice component to that has now been solved, but it's not changing people's behavior. It's not changing what they're eating. They're not eating any healthier just by solely putting the store there. So that doesn't really solve many things, but we do have to make better connections. There is like an educational component that we have to incorporate as well.
And that leads into my next question is, so how do you better equip families that are lower income and minority populations that maybe aren't as well informed about what they should be eating? How do you go about showing them, hey, there are places where you can get these foods that are better for you and your family? Yeah,
I definitely think so one thing, I'm going to use this Whole Foods on the south side of Chicago as an example.
Sure.
So that Whole Foods is in part funded by the Healthy Food Financing Initiative. This was a huge initiative to end food deserts in the United States that was funded by the Obama administration. So that was one of Michelle Obama. It was part of her Let's Move campaign. So it was multi-million-dollar initiative around the country, and it led to over 1,000 projects nationally. And that Whole Foods on the south side of Chicago is one of them. But just putting that Whole Foods there, they knew probably wasn't just going to solve the issue in the Inglewood neighborhood, which is a low-income black neighborhood, but they did a lot of other things too. So one of the things they did was develop a whole outreach team, and this outreach team was made of a lot of not just community workers, but also nutritionists for them to do some community outreach and do some education. But then they also made this Whole Foods part of just a neighborhood revitalization project because they want to bring opportunities for people to work. So if we're bringing in jobs into the neighborhood, people have money, and then they have more resources to potentially purchase healthy food as well. Sure. So it's there's a lot that goes into it, like the education, but also giving people the resources they need to even achieve this diet, because purchasing healthy food is expensive, especially absolutely. You have to track it seasonally throughout the year depending on where you live, looking at different prices and different sources of where you can get fresh produce and healthy food, but it's ultimately expensive than buying frozen prepackaged items or shelf stable food. But yeah, it's a challenge. It's an ongoing issue. So
now, what defines a food desert? A fresh food desert, I should say. Is it do you define it by how far something is in terms of miles, or how does that work?
Yeah, so different agencies have different definitions, but oftentimes people kind of go with the USDA definition. They do base it off of distance, but they have different definitions depending on the population density of the area. So if you live in an urban area, the definition of a food desert is very different. So they consider it to be about 1 to 2 miles. So if you don't have any grocery store within that area, then they would consider it to be a food desert. But in a rural area, it's a little bit different because you expect your amenities to be spread out more in a rural area. So they might go up to 10 miles in that area, or a suburban area might be somewhere in between. So it just depends. But they base it off of usually whether or not they have any type of full service store. So that would be a grocery store, supermarket, or maybe a super center like Walmart or Target, because they have a full grocery store section in them. And then sometimes they might use the definition of a swamp. So a swamp would be you just have a lot of unhealthy different types of stores. So fast food restaurants, liquor stores, so on and so forth. So if that's abundant, you're a swamp, and you could be both. And a lot of times in places like Chicago, on the south and west sides of Chicago, you have both. Your neighborhood might be considered a swamp and a desert. So, but I know for that Healthy Food Financing Initiative, they were only giving funding for healthy food retail projects. So either building a new grocery store, or bringing in farmers markets, or doing some corner store initiatives where they were making the corner stores healthy. But you had to be a USDA designated food desert, so based off their definition.
Well, the life of a professor at an R1 university involves a lot of research, right?
Yeah.
You're always working on new things. So what are you working on now that you're really excited that you'd like to talk about?
Yeah, so I can talk about a line of research that I'm trying to get off the ground and get funded. I have some grants under review right now. But one thing that I noticed, so I did my postdoc in Chicago. So I was on the Chicago campus doing my fellowship, and then when I became a professor, I moved down here. And I had a USDA grant to study the farmers markets in Chicago, particularly the ones in Black communities, just looking at what are their challenges of operation, looking at racial, ethnic differences in shopping behaviors and fruit and vegetable consumption. But one thing that came out of that research that inspired hopefully my new line of research is violence. So I definitely had that come up a lot in my research, both my qualitative and my quantitative research, just looking at how violence impacts people's decision making about where they're going to shop and what they're going to buy, and just just how they navigate around their neighborhood and period, like their whole built environment, just safety. And I had farmers market managers tell me we had to move the location of our market, we had to change the time, because farmers market season kind of overlaps with gun violence season. I mean, in Chicago definitely has a very clear gun violence season.
Oh, is that right?
Yeah,
is it summer?
It's summer. Okay. Yeah, it's usually the highest in the summertime, just because it's the winter time and people are not out and about as much. But you tend to have they tend to have the most shootings like in May, June, when things start to warm up. And that's when farmers market season is kicking off. So, people are out and about, and farmers markets are an open public gathering of people. And a lot of times people are now fearful in the United States to even go to open public gatherings for anything, just because, our gun violence issue. So I'm definitely trying to get a line of projects off the ground, where I study. I'm looking at some City of Chicago data, but also trying to collect my own data. Just looking at people who live in communities that have a really high violent crime rate, like particularly gun violence rates, and seeing how that impacts their food purchasing behaviors and decision making around food purchasing, because that ultimately might impact their health. So, especially when you're dealing with a population that, unfortunately, a lot of the communities with high violence crime rates are also lower income and mostly minority. So they're dealing with other economic challenges or low educational opportunities or whatever the case might be, but then they also have to deal with this other issue. So I'm trying to see if there's a connection between violence and food purchasing, because there's extensive literature on violence and physical activity. There's studies that show that if you live in a community with a lot of violence, you're less likely to be physically active. You're less likely to go outside, utilize the sidewalks, or even use the public recreation centers, or so putting revitalizing the trails and the parks and the green space might not impact physical activity if it's a high violent area. So I'm trying to see how it affects nutrition.
My thanks to Chelsea Singleton. To hear more about Illinois and the College of Applied Health Sciences, find our podcasts on iTunes, Spotify, and iHeartRadio by searching A Few Minutes With. See you next time.